It's a pretty leg now, right?
It's very pretty. Oh my goodness.
I cannot believe that.
Look how shapely your knee is. And we have just completed the first side for Heather.
Oh my God.
So this is all done completely awake with local anesthetic. How was it so far as pain and tenderness, pain and discomfort?
It's tolerable for sure.
There's pain and discomfort, right?
Yes.
The tiny leg and a tiny knee.
I cannot believe that's my leg.
That was your big side, because one side was bigger than the other, and that was actually the bigger side than this one too.
It looks so little.
So,
I have a knee.
so for you guys out there watching, this is a 360-degree sculpting. And I call it sculpting, I don't call it just suctioning, because other doctors, may suction and debulk, but, for us here at ArtLipo, it's a sculpture. And it's a very complete liposuction that, even with as much as we've taken around the knee, you see the knee doesn't have loose, saggy skin or anything, which people are always concerned about. But when you sculpt it very carefully up close to the skin surface, skin retracts very well. So,
Wow.
look nice?
Yes.
Okay.
I cannot believe that.
Oh, and then stand just a little bit apart. So what we do is we break the whole leg into two parts, what I call the cankles, calves, and knee complex up to here where it's blending. And we're blending because we don't want the upper leg to, you can't cut it off. So it has to be blended. And then we come back, if someone wants to do the upper leg, we have to do that on a separate surgery, which is a few months down the road at a minimum. And then we can do a 360 of the thighs too. For lipedema, it's very important to do everything all the way around. So when you move your legs, you had heaviness before. Do you feel any difference right now?
My leg feels so light. Oh my God.
So there is a pretty distinct,
Huge difference.
huge difference,
I
okay.
feel like I don't need to do anything to get this leg off the ground.
But before, right? We were talking about all the heaviness before, right?
This one, I can definitely feel the weight. This one,
Yeah.
so, oh my God, it gets up. It feels so much lighter.
Yeah, and then you're on your feet all day with with work, right?
Yes.
So that's one of the things that we see the biggest differences in heaviness and fatigue of the leg, and it's an immediate improvement when we take the fat off. And that's the wonderful thing about lipedema, is that you can treat it this way and get a very lasting result. Okay, Heather, thank you. Any last comment?
It's so worth it.
Okay. For you guys out there, Mackenzie's came in here for her legs because she has lipedema, all right?
Yep.
And it's been kind of a rapidly changing thing in your body for the last few years, right?
Rapidly progressing the last couple years, yeah.
Okay, and you've already had lipo on your arms.
Yes.
With good results, right?
Yep.
Okay, cool. So just one thing I'd like to concentrate on is pain, because a lot of people are asking about that. And on your arms, you had an experience that was incredibly painful. Also done awake with local anesthetic.
Yep.
And
With a different doctor.
with a different doctor, yes. How was today's pain? And be totally honest about everything.
The pain itself is tolerable.
Uh-huh.
There are parts that really hurt, but in the majority, it's like 80% is tolerable, and then you're gonna have 20 to.
You said you termed it brutal, right?
Yeah,
Okay.
yeah. There's some brutal moments.
Yeah. Now, how long were those brutal moments out of the?
5 to 10 seconds.
Okay, 5-10 seconds out of about 45 minutes of sculpting.
Yeah.
So there are points at which I have to have my patients tolerate some pretty stingy things.
Yeah.
In this case, brutal is probably a 10 out of 10 for a little bit, right?
Yep.
A few
a little
seconds.
bit.
Okay. All right. So long. We've kept Mackenzie waiting long enough. You want to see what everything looks like. Okay.
Oh my gosh. It's so pretty. Oh my gosh. It's so pretty.
It's a pretty leg now, right?
It's very pretty. Oh my goodness. I can't even believe it.
Some people say normal, but I don't even want normal legs. I
It's
want
not
pretty.
normal. It's not normal.
I
I've
want-
seen normal legs. This is like art.
Okay, so go and start turning around so you can see from all sides. You can go up on your tippy toes and put your hand right down. So you can see your nice calf shape right there, right?
Yeah, I have a calf and I have an ankle.
Yeah. Before I started the video,
Yeah.
what were you saying? Because you were just moving your legs on the table.
It's so incredibly light. Like, I can't believe how light it feels. Like,
Which was one of the main symptoms that you have is lipedema, right?
It's like you spend your life carrying around 35-pound weights on your legs, and then all of a sudden you pick up a 3-pound weight, and it's like, it's startling because it's so light.
So it feels like a lot of weight difference, right?
It's a huge difference. Like this feels so heavy. Like I can't actually like hold that weight up without balancing.
Yeah.
And this one I could do that all day.
Which in reality we only removed about 3 pounds, 3.5 pounds of fat. Yeah, so when you
Not
say it
very
feels
much,
like
but it feels
30
so
pounds
different.
lighter,
Yeah.
that's what we see with lipedema. All right, well, thank you. Any other comments?
Worth it. 100% worth it.
Worth the pain that you had to endure?
Worth the pain, worth like the scary feeling of going into it and wondering what it's going to be like, and worth the 45 minutes 100%.
Okay. We've just completed Sierra's right cankle and knee complex. And we've been doing this for lipedema, which has been bothering for a number of years, right?
Yep.
And I'll summarize what she told me. She's got a lot of heaviness and quite a bit of tenderness down in those areas, right, Tia?
Yes, correct. Especially right around this area.
Yeah, okay. And that's where she's really thick. Not just for symptoms, but you're really looking for a nice improvement cosmetically, right?
Absolutely.
All right. So one of the reasons you chose to come here, right?
Correct. I really would like to feel good about myself wearing dresses and shorts and skirts.
Okay. And then up to a few years ago, you were doing 5 to 10 mile run hikes.
Correct. And then my legs just became heavier and heavier, and it was just became painful and a little bit debilitating.
Yeah. So, are you ready to take a look?
Yeah, I'm excited.
Okay.
Oh my gosh, I'm so excited.
Wow.
I cannot believe these are my legs. Oh my gosh. Thank you so much.
You're welcome. So I told you, grandmother gave you some good stuff there.
Yeah, she did good. She did real good.
Yeah.
Thank you, thank you, thank you.
Okay. Awesome. How was it for you?
You know, it was actually extremely bearable. There was a couple tender spots here and there, a couple zings, but it was quick and they have easily moved on.
Okay.
I can't wait to get the second one done.
Awesome. You've been waiting a long time for this.
Yeah, years.
Okay. Awesome. Okay. Sierra, how are you doing after we finish the second side now? Are you doing okay?
Yeah, absolutely. I feel good.
Okay. Well, we've got to look at laying down. You want to stand up and take a look?
Fantastic. I love them. I can't believe these are my legs. I just saw myself.
Yeah, you can put your hand on my shoulder here if you want to go up on your tippy toe. Yeah, you have very, very toned calves now.
Oh my goodness, those are mine. And I feel so light.
Yeah, that's what Sierra and I were talking about last time, after we turned off the video. So, yeah, tell us how it feels to you.
Yeah, like before when I used to, bring my knees up and work out and things like that, I feel it was really heavy. It was just my whole leg was very heavy to lift up, and I feel like a feather now. Yeah,
I had you comparing when, after we turned off the video, you were comparing it one side done, one side undone, and tell them what you felt, the difference that you felt.
It felt like a 100-pound weight had been taken off my right leg, and my left leg was still stuck to the ground. It was crazy. And then,
how does it feel now? With both of them?
I feel like I can go for a run.
Awesome, right now. Okay. Okay, so huge difference in the weight.
Yep, the weight is, especially around my ankles. I mean, it's 110% different.
Wonderful.
It's so good.
Okay. All right. Any last comments before we go?
If you guys are thinking of who to go to, I think that, Dr. Sue would be that guy.
Thank you for the endorsement. Okay. All right. Okay. Say bye-bye.
Bye.